In your medical cannabis journey, the next step after visiting your QMP and obtaining your medical card is to visit a pharmacy. I'm Mindy Medeo. I'm a pharmacist who works at Beehive Pharmacy, and I'm going to walk you through it.
How do I find a cannabis pharmacy?
Look on medicalcannabis.utah.gov for a list of all the approved pharmacies. There are 15 pharmacies in the state of Utah, in both urban and rural locations. If there's not a pharmacy that's convenient to you, some pharmacies may even deliver to your home. Pharmacies sell different products and have different prices. You may have to travel to a certain pharmacy to get the product that you want.
How is a cannabis pharmacy different from a traditional pharmacy?
Cannabis pharmacies are staffed by pharmacists and pharmacy agents. Pharmacy agents are just like pharmacy technicians in a traditional pharmacy. The cannabis pharmacists have the same degrees and professional licensing as a regular pharmacy. A cannabis pharmacy might have some things that look a little bit different. Things like vape pens, gummies, and even unprocessed cannabis plant material that we call flower. Pharmacies are businesses and they are there to make money. The pharmacies do employ the pharmacist, but Utah law prevents a pharmacist from owning or profiting off of a pharmacy or any cannabis products. Feel free to ask your pharmacist about any conflicts of interest. Some people do feel guilty when they come to the cannabis pharmacy. I like to ask those people if they also feel guilty picking up their blood pressure medication. No, then you shouldn't feel guilty picking up cannabis. Cannabis is medicine.
How should I prepare for my first visit?
Once you've selected a pharmacy, you should check out their pharmacy website for educational material. You could also look on the state website. It's wise to know what cannabinoids do, what the different dosage forms are, and just general guidelines for basic use before you come in. As you're registering to be a new patient on the pharmacy website, if you have any questions, feel free to call the pharmacy or email them. You can even schedule a virtual consultation at home before you decide to come in and shop. When you come to a pharmacy, make sure you have a government-issued ID and your cannabis medical card. The medical card can be a digital copy on your phone. You should be prepared to pay for all of your products with cash. And if you forget, there are ATMs in the pharmacy. Bring a list of your current medications and be ready to provide details of any CBD or THC products you may have already tried. If you're feeling nervous, most pharmacies allow you to bring a family member, a spouse, or a friend to your first visit. Just make sure they also bring a government ID.
What is my first meeting with the pharmacist like?
Every patient has an initial consultation with the pharmacist. It usually lasts about 30 minutes. The pharmacist will want to know what your treatment goals are. They will talk about your symptoms, and if you have many different symptoms, be prepared to come up with a primary treatment goal. We'll ask you questions about your qualifying condition, your mental health history, and your previous experience with cannabis. We're not here to get anybody in trouble or to judge you. We need this information to know how to help you best. Be very open and honest and know that all of our conversations are confidential. We'll look over your medication list to see if there are any drug interactions we need to worry about. We also may suggest some adjustments to your medications if appropriate. We'll monitor for any warning signs of overuse or side effects. That's why we need you to be very open and honest about your medical history, especially your mental health history and your past cannabis use, even if it wasn't legal. The pharmacist uses this information to adjust your medication and watch for any problems.
What questions should I ask my pharmacist?
Ask about the different dosage forms and delivery routes. Ask about formulations. Ask about the different cannabinoids and terpenes and find out what their medicinal effects are so that you can tailor the right formulation for your condition. Ask about how you'll know if you've taken too much THC or if you've taken too little, and ask your pharmacist how to know when to repeat the dose. Your pharmacist can answer questions about legal consumption methods, driving, drug testing, gun ownership, and safe storage. If this is your first experience with cannabis, you might be afraid of being too high. Being high is not dangerous in itself. It's just a sign from your body that you have too much THC than your body needs. Talk to your pharmacist about all the risks and what may happen if you consume too much THC.
What do I need to know about reading labels and delivery methods?
Your pharmacist is going to walk you through different delivery method options. There's no rush to try everything at first. Depending on your budget, I would recommend that you try a couple different dosage forms or different brands or different formulations, but it's completely up to you how you'd like to shop. When looking at packages or online menus, you'll see different ingredients listed. Some of these ingredients are called cannabinoids, and they're things like THC, CBD, and CBG. Packages will most clearly label the amount of THC, but it's very important to look and see if the THC listed is the amount in a gummy, for example, or the amount of THC in the whole package. When using an edible, it's extremely important to always know how many milligrams of THC is in each serving.
Who should I talk to if I have questions about dosing or side effects?
Your pharmacist is available for free during operating hours. You can walk into a pharmacy and ask to speak to a pharmacist. You can call the pharmacy and ask to speak to the pharmacist. And some pharmacies even have a website option where you can chat with a pharmacist online. Remember, you don't have a prescription. You have the freedom to adjust the dose however you see fit. Your pharmacist is there to help you learn to do this and to make sure that your adjustments are within the QMP and pharmacist recommendations. Keep a journal of what you took and when and the effects that you feel. This will be very important when making adjustments to your dosage in the future. You can bring this journal in and show your pharmacist anytime, or you can bring it in and schedule a follow-up consultation to go over your dosing.
What should I say to my primary care provider?
Tell your primary care provider that you're using medical cannabis, and tell your healthcare provider if you've changed any of your other medications. Be honest with them. Tell them if you have any changes in your condition. Tell them if you have any side effects from the cannabis.